Well, good morning, everyone. It's a real delight on behalf of the Global Brain Health Institute to welcome you to this webinar on brain health education and training. I believe this in some parts of the world is known as Cyber Monday. And if we were going to purchase the human brain on some website today at a big reduction, we'd be astonished to find that unlike every other piece of technology you would buy, there is no user manual provided with the human brain, remarkably as the most complex entity in the known universe. So the purpose of this seminar, this webinar, is to launch what we think is an incredibly important initiative, which is to build our understanding, our education and training about the brain and brain health, with ramifications across all areas of life, from political life, from healthy democracy, to mental health, to innovation and the economy. And so I'm privileged here as founding director of the Global Brain Health Institute. My name is Ian Robertson. On behalf of the directors of the Global Brain Health Institute, that's Brian Lawler from Trinity College Dublin and Victor Valcourt of University of California, San Francisco, I'm delighted to welcome you to this webinar. And I'm particularly honored to introduce Professor Pavel Sviboda to introduce this seminar. He has a double role as Director General of the Human Brain Project, an incredibly ambitious European project, and also as CEO of eBrains, which is established in 2019 as an international non-profit association following on from the human brain. Dr. Sviboda served as Deputy Head and Head of Research of the European Political Strategy Centre at the European Commission since 2015. He has been Director of the EU Department at the Polish Ministry of Foreign Affairs from 2001 to 2006, and a number of other incredibly influential roles. So it is indeed a real privilege to have someone with such ambition for what I think is the most critical challenge for humanity, which is harnessing the incredible powers of the human brain to envisage states of the world that do not yet exist, and to make plans and developments in order to achieve these non-existent realities. It is our only option for facing up to climate change, for facing up to the terrible effects of tyranny and autocracy in creating conflict in the world. And it's incredibly important for dealing with the combined challenges of an aging population and the doubling of dementia that will happen, for instance, over the next 20, 30 years, particularly in the poorest countries in the world, and also the incredible increase of mental health problems, particularly in the more developed parts of the world. And the great opportunity of brain health and the education and training that has to go with that is that we have an encompassing, scientifically based, stigma-free approach to dealing with these global challenges. And so, Pavel, it's a real privilege to have you here, and thank you for introducing our webinar.
Thank you so much, Ian, for having me. I'm truly delighted to join today's webinar, and thank you for your leadership in Europe and globally in this area of training and education. So let me say at the outset that this has been a truly tremendous year for brain health, and it's not over yet. We are at the end of November, but there has been unquestionably a very strong policy momentum. When we look back at what happened in May, this was the adoption by the World Health Organization unanimously of the Global Action Plan on Epilepsy and Neurological Disorders. A month later, we saw the European Commission's flagship Healthier Together initiative, with also a separate chapter on neurological disorders and mental health. And then in September, the President of the Commission herself, in the State of the Union address, announced a new mental health initiative. And from all we know about it, this was really her own idea to propose this, which is meaningful. I think it does tell us where we are today. There is also tremendous momentum in research. We are seeing that in the Human Brain Project very often. And with the eBrains research infrastructure, we're now better able to help researchers and scientists in this fields. Lastly, but not least, discussions are now ongoing about the future European Partnership on Brain Health. This is due to start in 2025. And this will be a private-public partnership bringing actors from around Europe for a new set of innovations to be achieved in brain health. Surely aging of societies has something to do with it, and you have alluded to it, Ian, already. The number of people with Alzheimer's disease is indeed expected to triple by 2050. And we are also living through what the health commissioner in Brussels, Commissioner Kyriakides, calls the turning point for mental health. Conceptually, important progress is to treat brain health holistically through a life cycle approach. This is at the heart of European Academy of Neurology's very influential One Brain, One Life, One Approach strategy published earlier this year, which if someone hasn't looked at yet, I would strongly recommend that you do so. What it means is that there needs to be a pivot towards prevention, which is not only conceptual in its nature, but actually real, meaning implemented on a day-to-day basis. And this pivot to prevention is very much drawing on the realization that, as evidence now shows, up to 40 to 50% of dementias and 50% of strokes are potentially preventable. And policymakers need to be made aware of this, because I can bet that a lot of them are not aware of these figures. All this is more difficult than meets the eye, since only 3% of national health budgets actually support health promotion and disease prevention. So to start with, this is the question about available resources. Prevention is the basis, but it's not the only part of the solution. In fact, the EAN, in its strategy that I just mentioned, speaks about 4 Ps: preserving, protecting, and preventing, and then planning. And training and education are a genuine lever of this paradigm shift that is needed. It is a super ambitious proposition. But I think what we are here to do today, Ian, is really to discuss not just the conceptual underpinnings for it, but much more so how to make this happen, how to make sure that training and education on brain health is really rolled out at scale across Europe and globally. Because on the merit of doing so, I think all of us will agree. But as mentioned just now, with the very scarce prevention budgets, I think the pendulum has not yet gotten to where it needs to be with regards to the actual funding streams and actual enabling steps that need to happen for training and education to be genuinely up to the task. So thank you for having me at the outset. I'll return in the panel discussion and greatly look forward to and what the speakers have to say. Thank you, Ian.
Thank you very much, Pavel. And my goodness, imagine we could prevent 50% of strokes and 50% of cases of Alzheimer's. What a bonus, what a payoff that would be. So that's why this webinar is so incredibly important. Now, as you say, Pavel, we need to think about action here. And I want to introduce 5 speakers who are going to be talking about tangible action in this area. First is my dear colleague, Professor Brian Lawler, who's site director for Trinity College Dublin, leads the Global Brain Health Institute, and I'll leave Brian to introduce that GBHI. And Neil Fullerton, who's project and communications lead for Brain Health Scotland, which is a remarkable initiative in prevention in brain health. Really, Scotland's a leader in this area. It's doing fantastic work. Agustin Ibanez is another remarkable global leader. He is director of the Latin American Brain Health Institute. He's a fellow of the Global Brain Health Institute, but he's also, we're privileged to have him as a professor here in Trinity College Dublin, as well as his home university in Chile for these 2 years. Paul Verschure is professor of neuroengineering at the remarkable Donders Center for Neuroscience at Radboud University. It's fantastic to have you as a leader here, Paul. And then Eleanor Bayen, who is Professor Eleanor Bayen from the Sorbonne. She is director of brain injury services at the famous Salpêtrière Hospital in Paris, also a GBHI fellow, and has done amazing work with brain health education in children. So can I hand over, please, first of all, to my dear colleague, Brian Lawler.
So I'm just going to tell you about the Atlantic Fellows for Equity in Brain Health training program here at GBHI. So our brain is our greatest asset. Brain health is not just the absence of diseases, but it's more about getting the most out of your brain, protecting your brain, and decreasing risk to your brain and building up your reserve. And so brain health is essentially becoming new heart health. 40 years ago, 50 yewas ago, the idea that we might be able to prevent heart attack and stroke through a modifiable risk factor, addressing modified risk factors was a new concept, but now we know that this can happen. So we believe that the same is true for brain health, that there is a potential to prevent dementia by addressing and tackling modifiable risk factors. The big problem we have, though, is the knowledge gap. And while there's great potential to prevent dementia, there's a very significant knowledge gap out there, not just among the lay public about normal aging and dementia, and the fact that the belief that there's nothing that we can do to prevent dementia, but also healthcare professionals actually are poorly unaware about the potential to address modifiable risk factors and prevent dementia. So there is a major knowledge gap out there that needs to be addressed. And this is why we need leadership and leaders in the whole area of brain health and dementia prevention, people that can educate and train the next generation to understand more about modifiable risk factors and how we can prevent dementia. So this brings me to the Global Brain Health Institute, where I work. This is funded by the Atlantic Philanthropies. And the idea behind GBHI is to tackle the wicked problem of inequities in brain health and dementia. So the cornerstones of GBHI are first and foremost this fellowship training program, which I'll tell you about, but also advocacy and training and education and the development of scalable interventions. So GBHI is one of 7 equity programs which are funded by Atlantic Philanthropies to tackle different aspects of inequities around the world. GBHI is focused on a transdisciplinary approach to brain health, taking a life course approach in terms of preventing dementia. So in tackling the wicked problem of dementia, what GBHI is about, and the Atlantic Fellows for Equity in Brain Health is about, is trying to change the narrative around dementia, taking a transdisciplinary approach, reframing dementia from the perspective of brain health. And a big focus is around awareness raising and education training in the area of brain health and dementia prevention. So the theory of change for the Atlantic Fellows for Equity in Brain Health program is that we identify and recruit to the program emerging global interprofessional leaders in the area of brain health and dementia prevention. They receive a common foundational program in brain health training and education. They also receive skills training, leadership training, and mentorship training. And then they connect and amplify and support their work as alumni through this Global Atlantic Fellows, the alumni program. And Through this program, we are trying to create a global movement in evidence-based brain health research, education, training, and practice. At this point, we have about 173 fellows across 46 countries, and you can see that they come from primarily from Latin America and the Mediterranean region, which was our primary focus initially. But now we're moving into Africa and into Asia. So it's a values-based program. We focus and emphasize values such as authenticity, fairness, openness, respect, courage, and empathy. There's a diversity of perspectives and approaches from the fellows. We focus very much on the social determinants of health, and very much center of mind is the voice of the person with dementia and their caregivers. The structure of the program is that the fellows come to University of California, San Francisco, and Trinity. It's a one-year residential program. Fellows come from all over the world. They come from different professions. So we have people coming from the sciences, from medicine, but also from the arts, from engineering, and architecture. They share cross-site activities in terms of training, but they also receive site-specific opportunities in California and in Dublin. And then they get together as part of cohort building, face-to-face, an in-person leadership retreat, which happens during the course of the year, but also at an annual conference. There are four program pillars: clinical lived experience, mentorship, leadership and skills training, and the curriculum. And let me just tell you a little bit more about the modalities and approaches. We focus very much on peer learning and experiential learning. What's interesting about these interprofessional fellows is that they all receive exposure to the lived experience for people with dementia and their caregivers. We emphasize peer learning so that the creatives, the artists can educate and help the scientists understand the importance of narrative, but also the scientists help the creatives understand the brain science behind dementia. There's a huge focus on collaboration through workshops, seminars, salons, and fellow-led sessions. And then we have didactic learning through a flipped classroom model. Most of the learning is done offline, and then fellows get together online for curriculum sessions. It's very much a discussion-based approach. Here you see the transdisciplinary curriculum. We have integrated materials from different disciplines right across and through the curriculum. We use case-based learning so that the artists and the creatives and the scientists can learn together. And this accommodates different modalities and different learning styles. One of the unique aspects of the Global Brain Health Institute is the Pilot Awards for Global Brain Health Leaders. We have a partnership with the Alzheimer's Association and the Alzheimer's Society UK, and fellows can apply for funding during the fellowship, and if they're successful, then they can take that pilot funding back to their home country as they begin to transform. And this is an integral and very, very important part of the program. After graduation, the fellows become Global Atlantic Fellows, alumni, and they remain very much networked and connected with one another, supported by GBHI throughout their career. And this is to help them achieve a global impact. So what does the next 5 years hold in terms of training and education for brain health and GBHI? Well, we want to move the training and education that we are delivering as part of the program to the fellows beyond the core fellowship program. We want to provide them with materials that they can use as Global Atlantic Fellows in their home countries, and then share with other disciplines and other specialists that they're working with. We're also working on associated model programs, and you may hear a little bit about this from Agustin. We're working with a university in Santiago in Chile, but also with the American University of Cairo in Egypt, looking at developing associated model programs, integrating brain health into Masters of Public Health, and also trying to look at the possibility of modeling GBHI in other localities where it will be adapted locally depending on culture and other necessities. We're also looking at brain health training across the life course for different stakeholders. For example, looking at training, education, and brain health for teachers. In Ireland, we have a major focus and a program working with a very large housing agency called Respond, where we're looking at brain health and housing and the impact of the environment and housing on brain health, and looking to develop that nationally and internationally. Also, we're exploring the possibility of developing arts and creativity for brain health and using social prescribing and working with artists in building out social prescribing for brain health in communities. First and foremost, what we want to do is create a culture of brain health as a value, that brain health should be looked at. So just like fitness, it's a value to be attained. It's something that can be attained by everyone. And that includes even people who have cognitive impairment or people who have dementia. Also to develop brain capital, which is collective brain health and brain skills of all our citizens for innovation and well-being. I think I'll finish there, and if people have any want to follow up, please go to our website at www.gbhi.org. Thank you very much.
Thank you very much, Brian, for a fantastic introduction to the work that GBHI is doing. Delighted now to welcome, unfortunately can't be here in person, but Neil Fullerton is going to have a recorded presentation on the work of Brain Health Scotland. So over to you, Mary, to show that recording.
Hello everyone, I'm Neil from Brain Health Scotland. I have to start off an apology. I'm very sorry I can't be there in person today for the webinar. I would have loved to have been. And I have to say a big thank you to GBHI for pulling this together, really. I think it's a fantastic idea to pull together this community so we can share and learn from each other on some of these brain health initiatives. I'll really look forward to watching the session back on record, and I'll 100% be at any future events. I think it'll be a brilliant community to keep together to learn from these education programs. So I'm just going to spend a couple of minutes talking about some of the recent initiatives we've launched in Scotland. Brain Health Scotland was established in 2020 with a mission of reducing the numbers of people who develop dementia across Scotland, and we're very fortunate to be hosted by Alzheimer's Scotland, which is our national dementia charity here in Scotland. And so we set out to achieve this mission across a range of different activities, from clinical work to public awareness raising, health promotion campaigns. But one area that we're particularly passionate about is opportunities for education. And so our first foray into this was with the launch of our massive open online course. This is hopefully gives an introduction to some of these brain health principles, and for us puts this in the context of dementia prevention. We launched this on the FutureLearn platform, which means it's a massive open online course. It's completely free to access. It runs over 4 weeks, and we really set this up intending for a general public audience, in that there's no prior knowledge required, and then the knowledge builds up over the 4 weeks of the course. But interestingly, I think what one thing that we found is that we actually ended up attracting, unexpectedly or otherwise, attracting a lot of health and social care professionals, and really interestingly, a lot of people maybe starting out on the course who wouldn't have seen their own work as being necessarily relevant to brain health, but then through the course of completing the modules, starting to reflect on how they can take some of these principles forwards in their own practice, which I think is really quite an exciting development. That'll be interesting to follow through as the course matures too. Our second online course launched just earlier this year, and it came from a slightly different point of origin, in that it really came from conversations, a growing conversation that we were having from the sporting community. And in a way, it came from a place of concern from coaches, players, parents wanting to have access to reliable, credible information around, obviously, the risks of head injury. But for us, it was important in the wider context of sport in general, taking a pan-sport approach and also looking at the benefits of exercise and sport for the brain, of course. So my colleague Stephanie pulled together a fantastic team of educators, including our experts from GBHI, to really take a bit of a deep dive into, again, those principles of brain health, but putting that in a context for people who are interested in sport, and providing that accurate and reliable place to get that information. And I think one of the things that Stephanie did really well on as well was not just to confine all that learning to a course where you have to sign up and complete the course from start to finish, but to also build these kind of, where can we take information out of the course and deliver it in bite-sized chunks as well. So we built these kind of sports community pages, which yes, offer a way into something like a formal online course, but also, as you can see in these colored boxes here, maybe provide, if someone's just looking for specific bits of information, they can access that quite quickly. And then you find this quite interesting two-way street where some people access this kind of resource first, and then are quite interested and think, oh, I'm going to sign up and take a bit more of a deep dive into that kind of more structured course environment. And then likewise, you get the other way around, where some people maybe completed the course and then want to engage with smaller bits of information for updates and to follow up. So we're still fairly new to this. That first course has been running about 18 months now, and the sports course, as I say, launched this year. We found hosting it on an online digital platform like this really beneficial. It gets you that global reach. So FutureLearn has about 17 million registered learners. Our courses have been taken by about 6,500 people from over 150 different countries so far. Learners seem to like that kind of self-paced, self-directed learning. The content is hopefully quite engaging, and then it's mainly video-led and interactive, and discussion forums and short articles. And as I said, a lot of people we see seem to be using it to kind of develop their own professional practice as well, and take these new learnings forward, which is really interesting. I mentioned at the start taking a life course approach to these education initiatives too. And so one other area I wanted to mention was our newly launched primary schools program. This is brilliant work that's been led by my colleagues Joanna and Sophie, and it's taken those same core ideas, I guess, but trying to deliver these directly to young people. And we know that if we can instill good habits early on in life, that people are maybe more likely to achieve success, taking those forward, sustaining those positive choices going forward. So the schools program speaks to 8 to 12-year-olds. It can all be delivered in classrooms, in sports groups, in community groups, and it uses this analogy that runs all the way through of stars, there's as many connections between the brain cells in our brain as there are stars in the galaxy. And so it uses this analogy to introduce the 5 key areas, that uses stars as an acronym, 5 key areas for the children to think about in terms of protecting their brain. The resources are all, as I say, freely available to download via the dedicated website space, and we're offering this out to hopefully reach all primary schools in Scotland, for teachers to be able to download the resources. It's built around a series of animations and cartoons, and then also lesson plans, activities, take-home resources. And I think one of the things that was came out as really important, Joanna and Sophie ran working groups with teachers and also working groups with parents. And whilst the main aim of the program is to directly reach the young person to empower them to be able to look after their own brain health, we also appreciate that children of that age don't always have full autonomy over all their decisions. And so we thought it's really important to also reach those other decision makers, so mainly parents. So as well as all those resources that get delivered in the classroom, there's also take-home resources that go back home to, I guess, get a bit of a 2-for-1 there, and educate parents as well on some of these principles who obviously wouldn't have learned that through that school education environment in their own time. So the program launched just a couple of weeks back, end of October. We were very fortunate to have 100 primary school children from the local area join us, and we could screen all the animations on the big screen in this auditorium. And then we did breakout activities with the children as well, so we could get the children involved in, as you can see, they're scribbling up their own ideas of things that they'd learned. The left-hand picture there is a professional climber, Dave McLeod, and he was talking to the children about what kind of things he has to do to keep himself in peak condition. So from nutrition to sleep, you can see he's wearing his helmet there, so the importance of protecting himself. And so I guess to finish on on some of my reflections on this is that it's quite an exciting time, really, in this area. I've pinched a graphic here from our colleagues at GBHI to show that rapid rise in the brain health movement, if you like, the use of the ideas behind brain health in this example in the medical literature. But I think what excites me is, you know, off the back of that rise in those kind of publications is the spawning of all these initiatives that promote brain health awareness, and most of these would have education, I think, at the heart of them. And then, as I've said, specifically, we start to see new programs reaching young people, led very much, of course, by the work of My Brain Robbie, which I know we're going to hear from Eleanor as part of this session too. And there's other great examples that are starting to spring up now, the Brainable group in Canada, and hopefully we can add our schools program to that mix as well. So thank you very much. Again, apologies I couldn't be there today, but if anyone wants to get in touch with any questions at all, here's all our contact details, and we're on all the usual social media channels as well. So enjoy the rest of the session, and I really look forward to catching up with people afterwards. Thank you.
Well, thanks very much to Neil for a really exciting presentation. We're really delighted to be collaborating with Brain Health Scotland in GBHI, and these are remarkable achievements. I'm really pleased to welcome Agustin Ibanez, who is director of the Latin American Brain Health Institute. He's an Atlantic Fellow from GBHI, and he's also a dear colleague, a visiting professor for 2 years at Trinity College Dublin. So I very much welcome Agustin. Hand over to you.
Thank you so much, Ian. It's a great pleasure to me to participate in this extremely important meeting. I want to talk about brain health education and training in Latin America. The first thing that you may think is that there's so many other problems in Latin America, like nutrition problems, childhood health, violence, instability, economic crisis. But in fact, those are all factors that impact in brain health. And brain health is just a long-term consequence of many of these problems. So Latin America needs to focus in a critical aspect of brain health across the lifespan. So just a second for my disclosures. And like 2 years ago, we published this paper. We were able to make a survey on more than 3,000 health professionals working in aging and dementia across Latin America. And results, although unexpected, also expected, they were very, very serious. So most of the people doesn't know about brain health, doesn't know about the public policies of their own countries. This is, pervasive across different public, private, and sectors in the north or in the south part of Latin America. And more important, most of the people doesn't know about current available online and tools for supporting brain health, but they realize the need for manuals, for tutorials, and for data sharing of information. Even early on, we already, when we created a kind of consortium of Latin America across experts, we realized that most of the challenges that the region face, like, having a positive dementia culture, improving the lack of awareness, improving the training, maximize the scientific interactions, and making translation, most of those challenges depends or are related with education. So this is a really, really, really critical topic for the brain health in the region. But most important, I think that we need to make a strong case in the region that brain health is not about health or medicalization. It's about how to improve the lives of the people living in a region with one of the largest inequalities. And I just want to praise the work that Harris Heide, Wald Dawson, Erin Smith and many others are trying to bring this idea, how we can change society, how we can change inequality, how we can improve economies and education through brain health. I think that Harshis is going to talk about this later on, but I just want to put attention on that because we are trying to create seeds about these insights across different sectors, educational, scientific, public policies, and even in the young people. So one of our consortium, the Latin American and Caribbean Consortium on Dementia, has been trying to push this agenda. And we have been created a kind of webinar that are being attended by hundreds of participants each time, bringing together scientific policymakers, people working in clinics, and even people, outside the field of brain sciences, to think about how we can improve the brain health of the region. Those are self-organized interactions supported by the GBHI and the Alzheimer's Association, and being helpful to start to create some insights about the needs that we have in the region. As researchers, we have been working also in developing educational tools, trying to understand, the problems in the region beyond the specific field of research of each of the researchers, and trying to think about the future, how we can use brain health diplomacy and the idea of brain capital to improve the condition of the people, the families, the patients, the researchers, and the stakeholders. So this idea of brain health has been used to try to figure out long-term changes for dementia caregivers, for instance, which are one of the caregivers with largest burden in the world, how to reduce the impact of COVID on aging and dementia, how to create, tools for harmonized diagnosis in dementia in the region, how to create a specific regional framework for biomarkers, and how to have a kind of regional action plan at the level of the region. We also have been created the Latin American Brain Health Institute that is affiliated to the GBHI. Instead, beyond doing research and focusing a specific area of research, we want to push an educational agenda. So first of all, we are going to develop a fellowship that is inspired in the GBHI Fellowship, Atlantic Fellowship, that wants to bring support for the local leaders. The concept of mentoring, for instance, doesn't exist in Latin America. You can have, advisors or people that help you with a PhD or postdoc, but not people that is thinking how to make impact together and how empowering the people that want to make changes. Also, we will have the first PhD in brain health in the region that will be more research oriented. And we need to connect Latin America with US and Europe. We need to make more interchange and training. And one emerging idea is the European Latin American Brain Health Academy that is strongly supported by Owen and Brian. And we are working hard to develop a kind of intercultural education programs. But I just want to mention that we not only want to focus in a classical educational area. So for instance, the images that you see in the right side of the slide are showing two musicians that are, using music to change the path of their life, the life that they are, under vulnerability regarding, drugs, violence, and many negative aspects that impact in brain health. But we want to help this kind of musicians. So in this example, we invite these musicians to Trinity. We provide a learning experience on how to train, how to teach them to teach to the students about brain health. They are now creating a school for children under vulnerable population. And we want to connect, arts and creativity with health, with Dominic Campbell and many other great people. This year, we have the great pleasure to develop the first international course with more than 26 experts, mainly from the GBHI, but from other regions in Latin America also. And our results were outstanding. The students all postgraduate students were just, shocked about the opportunities to develop, brain health initiatives in the region and how they can connect with the local team. So we are working to develop larger, more scalable opportunities in the region to try to democratize and to make a something available to all the people, not just experts, not just people that have the unique opportunity to come to the first top centers in the world to develop brain health, but also in the small communities and in very, very poor or rural areas where the people can start to think about in the brain health, brain capital, and brain health diplomacy. So this is just the start, but I just want to thank the GBHI for giving the opportunity to the region to improve the educational resources on brain health.
Thank you very much indeed, Agustin, and really comprehensive, incredible range of work you're leading there. Just to remind everyone, there is a question and answers function. If you have any comments or questions for any of the presenters, by all means, go to your Q&A and put it in there. It's my privilege now to introduce a remarkable scientist and indeed artist, Paul Forsure, who has worked on some amazing innovations in neurorehabilitation and also in the intersection of robotics and human brain function, and an artist with a number of installations under his belt and an activist as well. So Paul, it's a great pleasure to have you present here, and we look forward very much to hearing what you have to say.
Great. Well, thank you very much for including me in your webinar. It's great to be here, and well, we're having a mission indeed of how do we educate the many end users of digital brain health technologies in the proper use and also scaling of this kind of technology. And we're active in this now for almost 20 years. So at the time, I was trying to find ways to validate brain theory. That's my day job in some sense, is to try to understand how the brain works. And for that, we built theory. And then the intuition was, well, maybe if we want to validate theory, we should go to the clinic and build interventions to test core principles of brain organization. So not so much just follow the clinical habits, but really start from first principles. And from that, we built what's called a rehabilitation gaming system, which is mapping about 20 core principles of brain organization in health and disease to rehabilitation protocols that we present as immersive, goal-oriented, and embodied task engagement. So essentially, we project this brain into a virtual reality environment in which that brain has to solve tasks. And then we manipulate everything we can in these tasks. And we have by now published almost 50 clinical studies with the system. And we have shown that we have better impact on recovery at any stage post-stroke, from acute to late chronic, in motor, cognitive, language, and affective domains. So this has worked really well. But then, of course, if you see that you start to have traction, it works, you know why this works and how you can improve it. And actually, RGS is really also now leading the field internationally. Of course, you get this request from rehabilitation centers, from patients. We would like to continue, we would like to work more with this system. So for that, we then built a spin-off called Eudine. I will put the links in the chat if I can get access to the chat later. And by now, we are in use in about 100 centers across Europe. We treated over 4,000 patients, hundreds of thousands of hours of rehabilitation sessions, all delivered through computers and mobile applications. So that's the specific perspective here, where we say, no, we have to find scalable solutions to brain health because of the large numbers of patients we got to treat and the huge costs involved following the standard treatment pathways, right? This often involves transporting people to rehabilitation centers, which in itself is costly, supporting their rehabilitation with other humans, therapists, clinicians, which are expensive. And very often, certainly in the chronic phase, if you talk about, let's say, stroke, patients are left to their own devices at some point in time, which I think is really a horrible reality, right? So chronic patients post-stroke, after about a year, also thought, look, this is it. And indeed, in some countries like the Netherlands, for some rehabilitation doctors, the key recommendation, well, learn to live with it. And I think that's really objectionable, because we know, just scientifically, that also late chronic patients, 3, 4, 5 years post-stroke, can still improve with the proper interventions. So we also have scaled our interventions now to Ukraine. We're used in 17 hospitals there, also because we've taken not only a brain-centered perspective on neurorehabilitation, grounded in basic brain theory, but also we have capitalized on just consumer electronics. So this is the second commitment we make. I'm not a big believer in dedicated hardware because it's expensive, it's not scalable. Look at, for instance, a Locomat, something like this, a device with not completely convincing clinical evidence behind it, extremely expensive and only accessible to a few. This is not going to serve our communities, right? So we have to look at scalability, we have to look at cost. And for that, our emphasis is really on rehabilitation as a service, so software as a service, capitalizing on the presence of consumer electronics, PCs, mobile phones, what have you, right? Game computers and so on. So that's what we have in our hands. And then now another reason why this is becoming even more relevant is that a few years ago, the Stroke Action Plan for Europe was published, which commits the European community also of specialists and rehabilitation clinics to the one hand, move 90% of patients really into dedicated stroke units, to also provide early supported discharge. So that means we have to provide services to allow people to get home early and also be supported in that context, and to also provide direct rehabilitation programs in the community. It's a very ambitious target for 2030, where suddenly we have to think in a much more distributed approach for neurorehabilitation, post-stroke in this case. And the question for us, how the hell can we ever do this, right? Do we have to train thousands, hundreds of thousands of more specialists to do it? We know that's not feasible. The World Health Organization already tells us. We have a massive shortage in qualified staff in these kinds of medical contexts. So how can we proceed? Well, scalable technology. So this is where the approach we've taken with the rehabilitation gaming system falls exactly in that sweet spot where I think we need to make progress. But now, okay, so yeah, we have the technology, we've done the science, there is the need. How do you get traction, right? So, and there, one thing that we learned is that the language of, let's say, evidence-based medicine, which of course something that as a scientist you're very familiar with, or the language of value-based healthcare that you might be more familiar with if you come from, let's say, health economics, or from a reimburser's point of view, like you want to deliver high quality care for the lowest cost, might not necessarily be a perspective that it translates well to many of your end users, because with the kind of technology that we have, your end users are patients, their caregivers, the therapists involved, the clinicians involved, the hospital administrators, the researchers, right? So there's a whole various groups of stakeholders that are coalescing around this kind of technology and might all have a different perspective. So there, what we learned, for instance, we had a big experiment supported by the European Institute of Technology Health, where we looked really at the at-home application of our technology in Sweden, France, and Spain, to make sure that we had continuous support and also adherence by our patients. We built an education platform, because what we realized after also trying to scale this approach in the market of healthcare services, is that people didn't fully comprehend the potential of these tools or their limitations. So we enter often a rehabilitation center, or we work with patient groups through, let's say, a workshop to introduce a technology, to answer the first set of questions. But you quickly realize that people only pick up a very limited subset of information that fits their own immediate needs. Like a therapist just wants to know, what do I do with this? How is this a tool that I can include in the other tools I'm using to improve rehabilitation? They might be somewhat less interested in all sort of detailed deliberations on mechanisms of plasticity. It's not that they don't have the capacity to understand that, but they're under enough pressure as it is, right? So in terms of their priorities, that might not be the first one. The same for patients. I could tell a patient a beautiful story about the frontal parietal network and how important that is in creating conditions for functional reorganization. The patient would say, look, I just want to know what I have to do to get better. Can I get better? And so on, right? So what we discovered in growing into this domain from a perspective of science, that it was really this Tower of Babel situation with a lot of miscommunication, even though there were many good intentions. So therefore, we have taken the initiative to now build this education platform, where we look at, from the perspective of the specific technology that we've built, on two main stakeholder groups. On the one hand, of course, patients, with very much a perspective of trying to, on the one hand, explain to patients and caregivers, what does it mean when you've had a stroke? What does it mean to possibly recover? What can you expect, right? On the other hand, for the clinicians, and in particular therapists, who are of course the closest interface to patients, we look at particularly at the question of, what can I do? What's this tool like, and how can I deploy the many different protocols that are available for, let's say, different kinds of symptoms categories, from cognition and motor to aphasia and chronic pain, let's say. How can I find my way through that complexity? So try to structure that through this education platform. And also we now have then further elaborated this strategy, that we also then augmented with dedicated and very short training videos. So in these situations, you don't need long lectures. You just need very concrete, fairly short summaries of insight, ideas, and especially what you can do. So very concrete videos of different protocols, how they work and why they work in the way that they do. And then behind that is also still a frequently asked question system, that if people want to get more pointers or want to get more background, they can consult that system. So this was the setup that we have built. But the biggest challenge we see is this variety in interests and points of view that we have to serve. We cannot prioritize one over the other. All these stakeholders have to in the end work together to make this system work. And why is that so? Well, in the end, what you deliver with this kind of health technology is not a front-end app, right? It's a game-like environment in which you perform certain actions. That app sits at the front of a very extensive pipeline of processing steps, right? I'm collecting continuously data from my patients. I measure all their movements in our case, for instance. You might measure with wearables, also their heart rate, what have you. This might be further compressed and also combined with more clinical data that comes from patients, integrated in also digital twins, which is, of course, really the emerging concept that's very central. And from there's an information system that has to provide insights to the clinicians to also inform them what is the state of this patient, what would be the next steps in the rehabilitation. And from there, it feeds back to the patient. So it's really a patient in the loop pipeline, for which his front-end application is only a little interface. In some sense, it's the least important part. You see that increasingly, it's this whole data processing pipeline that is making the difference in the effectivity of this kind of intervention. So what we've seen, so we deploy these pipelines, as also in this at-home experiment is described to you. And what we see that in this combination of interventions, we have adherence of patients that is significantly higher than recommended, right? So for instance, in this specific case, we recommend 20 minutes a day of rehabilitation training, and we see patients are engaging much, much more. So we speak about an hour plus a day. And we think this has a lot to do with also the patients taking ownership of their participation in this whole system. So we see this is creating traction with our end users. This doesn't mean, however, that the story is finished, because of course protocols change, technologies change. For instance, one big challenge we see now, we are further advancing this system in a number of European projects, in which also eBrains, Pablo Svoboda is also here, is one of our partners, because we see for scalability, we have to go to really solid industrial scale infrastructure to scale this. And that of course means, again, new technologies are being added. We look at more advanced AI techniques for data compression and data interpretation. This raises new challenges also for explaining to end users what are the ingredients of that pipeline that they're actually interacting with, right? So we just made the beginning in this whole endeavor. We learned a lot, made plenty of mistakes, but I think we have seen, at least now we have identified the different elements we have to focus on in this process. So on that basis, I think we can now start to scale it in a more open-ended way towards the next challenge, which is in the end delivering on the stroke action plan for Europe. And that's a domain agnostic. So I'm looking forward to further collaboration and discussion around that theme, and I will put the links now in the chat. So thank you very much.
Fantastic, Paul, and just wonderful to see how important education and training is in the total ecosystem you're presenting. The final presentation before we go into the panel is from Professor Eleanor Bayen, another GBHI fellow who has been a leading light in brain health education. Also, she's a director of brain injury rehabilitation at the Salpêtrière. Eleanor, looking forward to your talk very much.
Thank you very much, Jan. So good morning, good afternoon, everyone. Thank you for giving me the opportunity to present our brain health initiative that is called My Brain Robbie. And my talk today is about implementation of brain health classes in French school. So, trying to move my slide. Yeah. So to begin with, just let me give you some words about the global approach here. We really try to translate the latest neuroscientific research into actions, right? So when you look at the picture on the left, this represents the trajectory of life and also the trajectory of modifiable risk factors of dementia over the life course. So here there is a list in colors where you see chronic comorbidity conditions that can be healed or cared, such as hypertension, diabetes, but also some social factors like education or social isolation, and also lifestyle like physical activity. So if we control for these modifiable risk factors, then we might impact dementia cases by 40%. So these evitable risk factors are of interest for prevention. And so dementia prevention logically started in older and middle-aged adults. Now, what was really disruptive, I must say that 5 years ago, we decided to focus on youth. And this is quite innovative and new because, you know, well, preventing dementia in children, this is kind of new. And so we really wanted to empower them about protection and investing in brain health and brain capital at young age. So My Brain Robbie initiative aims at reducing social health inequities early on. And for that, we provide brain health classes and brain health education. So this project was created thanks to a consortium with many different people. And the mission here is really to empower children to have healthy lifestyles, doable, simple lifestyles to protect their brain. This includes first a video of an animated Robbie brain. So this 7 minutes video helps children learn easy steps to learn about these neuroprotective factors. So education, physical activity, prevention of traumatic brain injury, healthy diet, the importance of healthy sleep, social interaction, etc. We have a website, open source, also with free educational pack. And then we use this video and this educational pack to implement scalable school interventions. So for 5 to 11 years old. Finally, we also have a public health research and international outreach. So the video has been recorded in 7 languages and the free educational pack has also been translated. So everything is freely accessible. So how do we reach as many children as possible, right? What is the French model about this experience of brain health awareness and brain health training? So I created a multi-level training that train first adult students who will then in turn empower children to protect their brains. So the academic teaching takes place in the university, but it can be done also online. And so we mentor and empower students who then go in dyads in elementary school. So you can see that one professor who will mentor 50 students will in the end over a year reach over 3,000 children. And we are doing that with many professors in many cities and universities. So the training exists in various formats, and we train the trainers with 2 parts. First, we provide them with a neuroscientific background about dementia prevention and also some notions about social health inequities. Then in part 2, we focus more on the how we can implement this. So we serve here on new approaches and empowerment strategies that talk to teenagers and children. And so by promoting brain health messages this way, we do it in a fun and nice way. So moving on now to brain health class implementation in elementary schools, I just want to give you some ideas about our timed up brain health classes. So we usually do it in the format of 2 hours of awareness intervention about brain health, 1 hour per week. So it's over 2 weeks. And so we show the video, we answer Q&As, and we make some activities with the children. During the second week, we will monitor the children's knowledge, their memory about the factors. So you can see here examples, and they will correct in red what they have been forgetting. But we do not only bring information, right? We also bring some interaction and interactive activities in a gentle way so that children can discuss their own daily lives and their own daily lifestyle. So let's take, for instance, prevention of traumatic brain injury. We'll draw a list with the children about every dangerous activities they think about, rock climbing without a helmet, climbing on the roof. We discuss, for instance, jumping into the water, with climate change, there is less deeper water, sport concussions, etc. And we really try to connect with them and to have them do small steps towards life change when it's needed. We also perform some pre and post assessments of knowledge and also of the propensity of children and students to change their behaviors. So for instance, in children, we monitor how much they recall, what is their highest recall, their lowest recall according to age. And we monitor also the satisfaction, their willingness to share the video, for instance, because we're also very interested in the intergenerational link. So how do the children bring the messages home, and how the ricocheting effect can be monitored. So the ricocheting effect is also important on our trainers, right? So the students, for instance, before the training, they are asked whether they think they can modify their own dementia risk, and mostly they say no, right? But then after the training and after the learning experience, they also try to think about their own behavioral and lifestyles. And this is of importance to us because all of this helps us improve the brain health awareness for society at large. So next steps, we just launched this year a new module. We called it the Superheroes module. So we had a pilot in teenager and it was working so well, so we decided to do it also in children. So this all started with this funny article from the BMG during the pandemic, where our authors studied and analyzes trajectories of superheroes from Marvel. So let's, for instance, take Spider-Man, right? If you want to explore Spider-Man lifestyle, well, he has some good points. He's highly educated. He has some friends, so a lot of social interaction. He's fit and doing physical activity. But on the other hand, Spider-Man is also having TBI, traumatic brain injury. He's having unhealthy sleep, right? He's mostly saving lives during night. And he's also slightly depressed, so some mental issues here. So here again, we try to connect and interact with this new tool with children and teenagers to empower them about those messages. Next step also includes international outreach. So we're developing the video and recording it in various languages. We are doing some courses in other countries. So for instance, connecting with the BrainLat Institute and mentoring some groups who are interested in implementing locally brain health pilots or initiatives. And there is also a new video in progress. So I want to express here my gratitude for all the international and national partners who are part of this adventure. I must say it's really fun. It has been a thrilling adventure. It's a fantastic for us researchers, academic, to move into actions. And also, I must say, children and teenagers are really passionate about the brain, and this is really helpful also for us to develop all this approach. So if you want to share or to know more about it, you can reach me, and thank you.
Merci bien, Eleanor. That was really impressive work, and there's a couple of comments in the questions and answers just saying how impressed people are with your presentation, as indeed with the other one. So thank you very much. I'm really thrilled to introduce our panel for today. Unfortunately, two people who were to be on the panel couldn't come. Harris Eyre, who's a great international leader in the Brain Capital Alliance, and Catherine Sayer, who's with the World Health Organization in charge of the brain health program. She unfortunately got an injury in her back yesterday, and she couldn't come today. So, but we're privileged to have three very distinguished people. We have Cynthia Alcide, who is the Director of Research at the Centre for European Policy Studies, and we've heard today that policy is just incredibly important here if we're going to scale these approaches. We have Laura O'Philbin, who's a Research and Policy Manager at the Alzheimer's Society of Ireland. And finally, we're delighted that Pavel Sviboda, who introduced this webinar, is still with us. So I'd love to just throw open the floor for just some initial observations or comments to you three people. Perhaps Cynthia, I could ask you to just give some thoughts in response to the presentations we've heard.
Thank you very much for inviting me. It's really a great pleasure, and it was just fascinating what I heard. Let me say that I feel a bit as an outlier. I'm an economist by training, probably the only one in this virtual room. But yet I work in Brussels, and I'm very interested in public policy. So I'm actually very confident that there are some areas where the multidisciplinary approach is actually very enriching. In the last couple of years, I've been working quite a bit on social policies and looking at social outcomes. And when we look at social outcomes, I think that there are areas in which mental health and brain development actually are quite important. And I want to throw on the table two areas which I think are interesting and maybe then we can have a discussion about it. The first point really relates to the labor market and what is going on in the labor market and the role of education and mental health. In the last few years in the labor market, we are seeing a big trend of polarization, whereby highly educated individuals tend to have more opportunity, better opportunities, and higher wages. While on the other side, the low skilled people tend to get low wages. We have an increasing number of in-working poor. So people who have a job, but still they don't manage to have sufficient resources to make the ends meet. And quite interestingly, in such a polarized scenario, there is a common trend, which is the increased number of mental health issues. The number of cases of anxiety, depression, burnout has increased in a cross-cutting way. However, the sources, the origin of the problem is actually quite different across the two groups, as it is the necessary policy response. So for highly educated, very often the main issue is really the pressure to deliver and the long working hours. While for those who are in the lower scale of skills, actually the main problem is really the workload, which is basically due mostly to combine different kind of jobs at the same time. So in this sense, policy responses to address this mental issues problem are quite different. Now, there's a lot of progress has been made in general. For instance, in Belgium, burnout has been recognized as illness, a work-related illness. So in this sense, the approach to address the problem is becoming much more structured from a public policy oriented approach. And in companies, now that there are a lot of policies, for instance, for improving work-life balance, but also in terms of education and training in how to get a more balanced approach. Of course, this kind of policies and initiatives are very difficult to find for the low-skilled people. So this is just to say that from a policy perspective and in terms of initiatives, the context is very different depending on the people who are approaching, and there is a sort of stratification which can be associated to education and skills. The second aspect, which is actually very dear to me, is the issue of early childhood education and care. So in social sciences, there is an increasing interest in understanding how participation of kids in early childhood education and care programs can affect social outcomes. So basically, there is successes in life, but also how healthy and how social they are. And basically, at least in the social science literature, there are two big streams. First is how participation in these programs can help the development of social integration, therefore development of emotional and social skills. There is evidence that kids who participate in early childhood education and care programs actually they tend to have a more positive behavioral outcomes in adult age. The second aspect is the role of early childhood education and care programs when it comes to the development of cognitive skills. So basically, the performance then of young adults at school, but also in life. So in this sense, there is a very strong attention and growing attention related to early childhood education and care, because fundamentally the brain develops faster in the early stage of life. So there is this aspect which is actually very crucial and explain the importance of those programs. And I think that the initiative which was presented by the previous speaker actually goes very much in this direction of how important is education early childhood, so up to 5, but also later on in life. Now, of course, one crucial point from a policy perspective is how to make sure that actually certain services are offered to all kids, but also about the quality of the service that is offered. And from this perspective, actually, the training of the trainers or the training of the educators, actually, it's of crucial importance in order to make sure that social outcomes are of the standard that we would like to see. I would leave it here, and I'll be happy to discuss it further.
Cynthia, that's such an interesting analysis from a policy perspective that really, and it strikes me that the brain health education and training approach is appropriate to all three of the groups you're talking about, the early childhood education, the people with low levels of education and different sources of stress, and then the higher performing people. It strikes me that there's a common policy approach might be possible across these three. Thank you so much. Laura, I'd be delighted to hear your thoughts and comments.
Great, thanks so much, Ian, and thanks to GBHI for having me on. So I work for the Alzheimer's Society of Ireland, and we're the largest dementia-specific service provider and advocacy organisation for people who are affected by dementia. I think what I've been really struck by this morning is how many pockets of great practice there are around the world. And, you know, we're talking about this knowledge gap that there's, you know, we know all this information, knowledge is power, but there's so much information that isn't actually reaching people that need to hear it. And I guess our duty as a charity and an organization is to try and mobilize the clinical, the research, and, you know, all of these organizations that are working in the area of brain health to try and bring them together. And, you know, Cynthia's just spoken very eloquently there about the policy issue. We brought a big group of researchers and clinicians together to present to the Oireachtas and the Irish government about brain health and about what's happening in dementia, to try and, I suppose, motivate our political representatives to start considering brain health and taking action in that area, because we're at this juncture now where we know more than we ever have before, and we have so much power to make change, but we all can't do it individually. And I think that's something that's so great about working in this area, is everyone wants to collaborate, everyone wants to make the best of what we can with what we have. And, you know, I've taken so many notes already of everyone that I'm going to follow up with, because there's we've great national collaboration here in Ireland, but I think the potential now for international collaboration around brain health, particularly for organizations like ours, is just incredible. So I'm really, really struck by that. And I think, say, the Alzheimer's Society or whatever other charitable organizations, no matter what age group they're working with, we have this base of people who are kind of a captive audience. So we need to really start taking a role in delivering that brain health message and trying to close up that knowledge gap where we can.
Thank you very much, Laura. The political aspect is so important to get the politicians seeing that there is the electorate, you know, have a big stake in this and mobilizing that. Thank you so much for that. Pavel, I'd be delighted from your elevated perspective in the EU. I'd love to hear your thoughts on this whole issue of brain health education and training.
Thank you so much, Ian. That has been absolutely fascinating. And if you allow me to follow up directly on what Cynthia and Laura have just said, I would like to comment that it is really important for us to both look at the individual actions on the ground, which are, of course, crucial to moving the needle. That's where the difference is to be made, but also seeing this bigger picture of how society and socioeconomic realities are today evolving, and this is what we heard from Cynthia and Laura just now. And what is super important for us is that we see a lot of neuroscientific insights being now recognized in policy making at large. I think this will be a growing trend. And early childhood education has been sort of for quite some time recognized as important in social sciences. And now when bringing the neuroscience insights into this about how brain plasticity is critically shaped in early years of life. I think we can really have a very powerful message to the policymakers that is grounded in science, and that's super important. Now, Cinzia also mentioned the mental health challenge, and I think we have to be clear about the fact that brain health and mental health are, of course, closely related. They are not the same concepts. Brain health is a crucial determinant of mental health across life. Nevertheless, given the pressures of today, and especially in the post-pandemic period, it's very clear that mental health will receive a lot of attention at the policymaking level. But I think our challenge is to position brain health and mental health as closely related phenomena, rather than to see all the attention span of policymakers being channeled into mental health. Important as it is, we need to keep that equilibrium in place. So what I would draw from today's discussions is twofold. I would think that first of all we need to look at the impact of training and education across life course. This was very powerfully underlined by several speakers. There are different constituencies that we would need to address the messaging to. A lot was said about the healthcare professionals, and I think the figures which Brian quoted at the beginning are very telling with respect to how much of the information activities need to be focused on the healthcare professionals who are often not fully aware of the brain health challenges. But I think Laura underlined just now this need for the multipliers to be there, and namely for the action, because after all, we are at the beginning of a process which I think will be quite formative for humanity at large in this decade and the next. But we saw today amazing examples of very powerful and illuminating and impactful action. But it's still a question of coalition building, of making sure that this entire activity reaches a critical mass, and that's where we need the multiplication effect in order for us to train trainers and for trainers to have an ever-growing impact. And my second conclusion, as I was listening to this fascinating debate, is that we need to have these things better organized at the national, European, and then global level. And in some countries, you see now emerging brain plans. In Europe, but also outside. I mean, Uruguay has a very interesting brain health program. So it's by no means only European specificity. We need to look for good examples also globally. And I think these are essential types of reflections to be held nationally first, and then also at the European scale. Because they would allow for priority setting. They would allow us to have better overview where resources needs to be allocated, and then it would need to be translated at a higher level than in our case here. It's the European level, and the timing is right because this European Brain Health Partnership is literally around the corner. This is an initiative that is meant to be in place in 2025, and the preparation will start next year. And it's not a simple operation. It requires first of all the identification of what is called in the Euro slang the strategic research and innovation agenda. So that's where you put all the necessary actions. And I think it's essential to put training and education very high on the agenda of that brain health partnership. This is how we can see the European level helping action and helping impact nationally. Thank you so much, Ian.
Thank you very much indeed, Pavel, and very interesting indeed, the going between the specific and the global approaches to all of this. And just to point a couple of the questions that have come up in the chat from one of our current fellows, Kim Wong Nguyen from Australia/Vietnam. She's asking you, Cynthia, just about are there some more short-term policy approaches we can take that could tackle all the different groups you're talking about rather than one? So I guess that was a question that I raised as well. But yeah, it'd be nice to hear your response to Kim's query.
Yeah, this is a rather difficult question. I mean, I think that there are many factors actually that can contribute to this anxiety, burnout, and all these risks of mental health. Some of them are actually cultural, because in many societies, actually the pressure to deliver and to work hard is also comes from some cultural elements. For me, one important point, maybe because I am an economist, but I think some of the issues actually need to be tackled at much higher level, because are very much related to existing inequalities. So in this sense, it's not only about providing some accompanying. It's not only about accompanying people and try to fix the problem when it comes. It's really to prevent the problem up front. And a lot of the issues are related to big uncertainties, for instance, related to the to jobs, or to increasing inequalities that basically put people in a position whereby anxiety really becomes the main feature of daily life. So it's very difficult to find a common approach, but I think it's not only the solution cannot only come from specific policies which are addressed to cure basically the mental health. Thank you.
Thank you very much, Cynthia. Unfortunately, we've only a minute left of this fast. We could go on for much longer. I personally feel there's so many strands, from the fascinating work of scaling up technology in, if you like, Paul's work, to the early childhood education, to the policy, the leadership training of the Global Brain Health Institute and the Latin American Institute, the global connections that are visible here. Thanks a lot of it to the connections that the Global Brain Health Institute has fostered through its fellowship leadership training program. And I have to pay tribute to Brian Lawler as co-director of this with Victor Valcourt. Finished by a big shout out to Owen Cotter, who's leading our brain health education and training in the GBHI in Dublin, who's done a fantastic job putting this webinar together. I thank all of you for giving us your time. I think this has been an important meeting, and we really want to follow up with all of you in cementing and developing these collaborations. Thank you very much indeed.